People have a tendency to hold strongly to their beliefs in folklore, and sometimes the consequences can be deadly. Back in 1847, Dr. Ignaz Semmelweis was put in charge of 2 different obstetric clinics at the Vienna General Hospital. In reviewing the records, he noticed that maternal mortality rates were very different between the 2 clinics. Now, the Vienna Hospital provided good quality medical care for the day, yet in one of the clinics, 7% of the moms were becoming ill and dying shortly after childbirth, and in the other clinic, 16% of the moms were becoming ill and dying shortly after childbirth. So Dr. Semmelweis began looking at the differences between the 2 clinics. For one thing, he noted that the clinic with the 7% mortality rate was staffed by female midwives, but the clinic with 16% mortality rate was staffed with male doctors and medical students. He investigated a number of factors: the position of the woman's body during childbirth. He wondered if perhaps the fever was caused because the new moms were embarrassed by the male doctors examining them. He wondered if the priests that sometimes attended the births would frighten the new mothers and cause the fever. But as he looked into each of these areas, he realized they were not a contributing factor. But here's what he did find was a factor. Every morning, the doctors would assist the medical students with autopsies in the morgue as part of their medical training. And then the doctors and the medical students would work in the maternity ward delivering babies. But the midwives were never involved in the morgue. Rather, they only worked in their maternity ward. So Semmelweis surmised that there were cadaver particles, he called them, which he described as decomposing animal organic matter, that somehow was being passed between the cadavers being autopsied and the moms in the maternity ward. So as a result of his theory, in 1847, Semmelweis instituted mandatory hand washing at the Vienna Hospital using a chlorinated lime solution because it removed the smell of the cadavers from the doctor's hands. And guess what? The infections plummeted, and the mortality rate in the delivery suite fell to 3% and remained low. But here's the part that's really hard to believe. Semmelweis experienced real difficulty with the doctors complying, and despite the successful results, the hospital abandoned the mandatory hand washing techniques. For one thing, they thought if the problem was the healthcare workers not washing their hands, well, that meant that the high infection rates and deaths were their fault. But that just seemed impossible as they were the experts. In any event, they stopped the mandatory hand washing. Semmelweis left the Vienna Hospital and he went to a town in Hungary where he yet again instituted hand washing techniques into a maternity ward and once again saw a dramatic reduction in maternal mortality. He actually wrote a book in 1861 on hand washing techniques, which at the time was severely criticized by doctors as they had other theories. It wasn't until several years later and after Semmelweis's death that the British surgeon Joseph Lister would push for hand sanitizing and sterilizing instruments, and the French microbiologist Louis Pasteur would further prove germ theory. Now, before you think how slow people were to change in the late 1800s, think about this. It wasn't until 1995 and 96 that the CDC and the Healthcare Infection Control Practices Advisory Committee in the United States recommended that either antimicrobial soap or a waterless antiseptic agent be used for cleansing hands upon leaving the rooms of patients with multi-drug resistant pathogens. And as for public behavior, well, the American Society for Microbiology discreetly observed 6,000 people washing their hands in 6 public restrooms around the country, and they found that 77% of the men washed their hands and 93% of the women did. So congratulations to the women. But a University of Michigan study that looked at nearly 4,000 people found that on average, people washed their hands for just 6 seconds, and 95% failed to wash their hands long enough to kill harmful bacteria, which, as we know, is 20 seconds and with soap.